Welcome everyone to the public training today. We really appreciate your interest in this topic. We're going to have some discussion about how data are used. We are recording this training. We provide these on our website and also on our YouTube channel. If you want to share it with others, or if you have to drop off or you want to go back to a specific point in the training, you're welcome to go to our website or to our YouTube channel and watch that. I'm going to go ahead and, all right, let's get started. This training today will provide examples to you on how data are used to impact policy and protocols, to improve patient care, conduct research, and even apply for grant funding. You are welcome to ask questions during the presentation, come off of mute, or put them in the chat. We'll watch the chat if that's how you want to ask questions or leave comments. Or you also are welcome to save them to the end. We generally try to plan on a few minutes at the end of each training for questions, comments, or if there's a topic that you just want a little bit more information on, we're happy to help in that way. The presenters today are Lauri Lunde. She's our state specialist with the NEMSIS TAC. And we have a special guest with us today, Brooke Burton. Brooke is probably familiar to many of you. She is the Quality Improvement Manager for Unified Fire Authority here in Salt Lake. She brings 27 years of EMS experience, and she specializes in performance improvement. Many of you have probably had the privilege of hearing Brooke speak at a national conference on performance improvement, continuous improvement, data quality. She's got a vast repertoire. She also serves on several boards, or she serves on the advisory board for NEMSIS and the advisory board for EMS World Magazine. She is the president-elect of the National EMS Management Association, NEMSMA, and the vice president of the National EMS Quality Alliance, NEMSQA. And she's faculty for several EMS leadership programs, where Brooke's been a tremendous partner in promoting quality EMS data. And we just really appreciate her being willing to take time and teach us all today some of her expertise. With that, I'm going to stop talking and turn it over to Lauri and Brooke for their presentation today. Thanks.
Thank you for that amazing introduction. Happy to be here.
Yes, thank you, Julianne. And I will start out with sharing just a few objectives for today. And we really do want today to be interactive. There will be a time for question and answer at the end, but please, if you have a comment on a topic or a question on a topic we're presenting or sharing about, feel free to jump in and interrupt and ask a question at any point as well. And I'm going to start out and then pass it off to Brooke. But Brooke, I also want to say, if you want to jump in on any of my topics or any of my colleagues or state data managers on the call as well, feel free to interrupt me at any point. I'm happy to share the stage here today. And so I'll start off with our objectives. As Julianne shared, we do want to talk just a little bit about how EMS data are used. And we're going to look both at kind of a big national perspective as well as a state perspective and even from an agency perspective, how the data is used or can be used. And we're hoping that you will learn something new today. Hopefully some of this are things that you've heard before, but hopefully you'll learn something new. And then also just be encouraged. One of my goals today is really to encourage and inspire and motivate and thank you for collecting such quality and timely data. And hopefully it'll just be a reminder that it really is being used to improve quality of patient care and even save patient lives. I know we sometimes lose perspective of that in the day-to-day of meetings and emails of what we're doing and the impact that it has, and that it really does matter. So first, we're going to make this interactive, as I shared today, by having a few polls. I have one question to start off the meeting, and we'll do a couple more polls at the end of the call as well. So if you could either use your phone and scan this QR code, or you can go to this website as well for Poll Everywhere. There's information on the screen if you want to enter that website, or you can also send a text, as it says, to the number 3760, or the QR code. Those are your three options to enter the poll. And once you do that, you should see, I think I need to go to the next screen to activate it here, but you should see this question pop up of how EMS data are used. And I can see some people are already answering it, which is great. And the words that are used more frequently will get bigger. So you can see here a lot of people are saying EMS data are used for quality improvement, patient care, improvement practices, safety, billing, estimating, delivery. Lots of good answers coming in. Thank you for participating, everyone. This is fun to see. Yep, education. There's some of these topics we'll touch on today, but there's so many that we don't even have time to discuss them all today.
You know, Lauri, I love that patient is big, though, because everything we do, number one, should revolve around that, right?
Exactly.
I love patient and quality care.
Yep. I know it often feels like checking boxes, and I'm sure at the end of a long shift, it's the last thing that clinicians want to do is fill out an EPCR report. But hopefully they can have the perspective that doing that is taking care of patients in a different way than in a hands-on way, but it is helping to improve patient care. Awesome. Thank you, guys. I'm excited to go back and kind of capture this image and maybe share it somewhere on social media or other places, because there's lots of great ideas in there. So thanks for participating. And we are going to share some tools that are available today on the NEMSIS website. And some of these may be familiar to you. Maybe some of them, it's the first time you've heard of them today. But basically, topics that we're going to touch on, and we'll come back and talk about these a little more in the next few slides. But we're going to talk about dashboards for one. There's several different type of dashboards. There's public access that EMS agencies and clinicians and any member of the public can access. There's other ones that are restricted to state level data, and you need to have a state level or a federal level login in order to access those. And so state data managers and often a few people on their team are allowed to access that data. The Cube is another tool that we're going to talk about a little bit today, that if you want to use it to compare state data to a national benchmark, or if you want to search for any information that's not found on one of our dashboards or not found in one of your software companies' dashboards. If you're a state data manager or a local agency, the Cube is something that you can access to find data not shared somewhere else. And then there's also something called a public release data set that we'll talk about. And that's a complete data set of over 50 million records a year that are shared. That's another tool if you haven't heard of that one. And then there's also the option to complete an individual research request. So those are some of the topics that we're going to talk about today. The first one we'll discuss a little bit is dashboards. And hopefully this is something that you're at least familiar with, that there are some dashboards available on the nemsis.org website. And with those dashboards, as we mentioned, some of them are public access and some of them are more restricted. But on all of them, you can, as you're looking at a dashboard, you can download reports And what that means is as you're looking at an image, or if you're looking at a graph on a dashboard and you want to know the data that was used to create it, the data behind it, you can go to the bottom of the page and there's a button there where you can download and turn it into either a PDF. You can save the image as a PDF, or you can turn it into an Excel document and manipulate and work with the data that way. There's also an option on those pages to subscribe. And that is a way that every time the dashboard is refreshed, you can get an email in your inbox saying the dashboard's been refreshed with a link to bring you directly to the dashboard. That's a great thing to do if there's something you're tracking regularly or need to give weekly or monthly reports on. You may want to subscribe for a frequency that works well for you, for a dashboard that you want to continue to track. And then along with those dashboards, there also are companion guides available that give you lots of information of what you're looking at on the dashboard. So it'll give you inclusion criteria, what elements were used in the creation of that dashboard, so you know what it is, what you're looking at. And then there often is also a video with a little tutorial of that specific dashboard and how to use it, or how to filter and run reports and things like that is usually included on the video as well. And so dashboards, if you have not used them, are a great thing to explore. And I know my friend Cassie is going to, I think, post a link to our dashboards, or actually she's going to post a link to the training. There's a recent training that we did that goes much more in depth into dashboards. And Cassie, if you wouldn't mind posting that in the chat now, that would be great. Thank you. And then I also wanted to mention just that dashboards are a good way to compare the number of records that are received and submitted to NEMSIS, and compare it to the number of records that are coming into you at a state level. If you're a state data manager or someone in that level, it's a good way to kind of make sure records aren't being lost or failing somewhere along the way. And so that's one reason that a lot of state data managers use dashboards, is to kind of for quality control and comparing the number of records submitted. Another reason dashboards can be used is to project things, like if there's going to be an increase in call volume on certain days or times or seasons of the year, perhaps. It helps you in planning for budgeting or allocating resources. And as I had conversations with state data managers, a lot of them said that's often what they use dashboards for, or to kind of make those projections and planning ahead. And it helps them do that. And then they also can be used for applying for grants, demonstrating deliverables that are achieved in grant funding as well. Anything to add there, Brooke, or anyone on the call? Anyone want to mention maybe dashboards that you've found useful? Or
I have a link to one of the dashboards here, or a picture of one of the dashboards in my slides coming up. So I'll delve into that a little bit more, but definitely helpful. And I think a lot of people at the agency level don't know that they're even there. So that's something that I'm hoping that maybe the states and the oversight agencies can help share with local agencies.
Yes. Yeah, absolutely. And I will share my contact information at the end of this call. I know Brooke will as well. And I'm happy to set up a call if there's anyone on this training today that wants just a one-on-one tutorial of dashboards, or you're wondering if there's a dashboard that's on a topic you're interested in, feel free to reach out, and I'm happy to give you a little one-on-one tutorial as well. Anyone else want to share anything about dashboards on the call before I go on to the next slide here? All right, in this slide, I highlighted, and our friend Chris, who again couldn't be here today on the training, but he looked at essentially each dashboard and the frequency that it was accessed in 2022. So he was able to look at that information, and I've listed here essentially in order of the most used dashboards. So from a state perspective, the dashboards that require a state level login, the EMS by the numbers was the most used with exactly 765 uses in 2022. And then the state data submission dashboard, that's one that I know data is really used for to compare completeness of how many records were submitted to a national level versus how many are coming in at a state level, is that data submission dashboard. That's a good place too to see if you're missing DEM files. It gives you a lot of that information, how many files failed when they were submitted, how many were submitted with warnings, things like that are available there. So that's a very popular one. And then EMS agency location, performance measures, which I know Brooke is going to talk about a little more. That's also a popular one. And then the current composition of the warehouse, which also gives you a total number of records broken down by a quarter or month or year or day even, and different opportunities to filter that information as well. So those are some of the most used state dashboards. And then the public dashboards, you'll see this first one here. This is a new one that was just released a few months ago and has over 22,000 views so far. So that's obviously a very popular one, a topic that's very important to a lot of states right now is tracking opioid. And this is actually a non-fatal opioid overdose tracker. And so we also have public trainings available for that dashboard specifically. If you go to our website and look at, if you find the dashboards and find this dashboard, there's a video available as well as a companion guide that gives you lots of information of what you're looking at there. But does someone want to, I didn't ask Cassie to do this, but if someone wants to put a link to that dashboard, I bet there's people on the call that may want to see that if they haven't seen it yet, to the opioid dashboard.
Julianne's got to cover.
Okay, perfect. Thank you. And then the public performance measure as well, which Brooke is going to come back to in a few minutes and share how she's used that, or some of the uses that agencies may have for that dashboard. And then there's also a 911 call complaint that's used very frequently. Motor vehicle crash is another hot topic that a lot of people are tracking and trying to work on ways to improve that. And then naloxone administration as well, related to opioid. So those are some of the most used dashboards or most popular dashboards that we have on the NEMSIS website.
So Lauri, I noticed that the opioid overdose tracker is really high. And I remember seeing that a lot on social media platforms, like links to that dashboard being shared. Do you have any insight or any of your colleagues on, do you have increased visits to your sites when you share those on social media? Is that just something I noticed, or is that something you have data to show?
Mm-hmm. Yeah, great question. Yeah, we did notice this. This was the first dashboard that really got this level of press. And Julianne, you can jump in if you know more, but I know there were probably well over 50, maybe 100 social media and media outlets that covered it and did spoke about it. I know NPR and CNN and Washington Post, New York Times, there were a lot of articles that referenced this dashboard. And so it got a national level of attention that we hadn't seen previous to that. And so the week that it was released, there was kind of an unprecedented amount of traffic on our website of people accessing that dashboard. But we do see that it continues to be used as well. Now that it's discovered that it's hopefully being used to help states kind of track areas, and it will break down by county and show which counties have a above average or below average number of overdoses in the last few weeks prior to it. So it's helping to maybe allocate resources to those areas or helping people to reach out. Does anyone else on the call want to add to that?
I'll just add one thing. This was a beautiful example to demonstrate to a lot of national partners the incredible value of EMS data and how timely it is. With all the agencies in the states that submit their patient care reports so quickly, they're able to, both states and national audiences are able to see it's near real time so quickly what is happening in different communities. And it was just this really great demonstration to people who hadn't realized how incredible EMS data really are. So this was a great opportunity to really showcase the great work that's being accomplished in the back of every ambulance across the nation.
Yeah, true. Thanks, Julianne. All right, we'll go on to the next page here, and I want to talk a little bit about the cube. And I think Cassie is going to put a link here to the cube and where you can find it on our website. But this is a great resource or a great tool if you have never used it. And there are several videos on the homepage of the cube there that give you tutorials of how to access it and how to use it. But as I mentioned earlier, if there's information that you can't find on a dashboard or you can't find through your software, you can really filter almost anything on this cube. And so it'll give you a national comparison as you're looking at your state level data that you have access to. If you want to compare how you're doing compared to a national level, this is a great way to do that. And as you can see, it was used or viewed almost 5,000 times in 2022. So we know it is being used. There's a lot of state data managers I know that will use it regularly to kind of compare information that they're tracking in their state. So again, I encourage you to copy that link that was shared and take some time to check that out. And there is a public access to that, so you don't need a login necessarily. So if agencies want to use that or non-state data managers, you're welcome to use that tool. Any questions on that or ways that the cube has been used by people on this call? All right, sounds good. I'll move on to the next topic, which is the public data set. And for those of you who are on our bi-monthly V3 calls, you hear me calling for data, especially towards the end of the year and in January, as we're hoping to get as complete of a public release of the data set as possible. And what this is that it's actually it comes in the form of a USB drive if you request it, but it is a very large amount of information. You can see it's even compressed. It's 15 gigs, 128 gigs non-compressed was the 2021 data set. So over 50 million records that were collected in 2021. And we are currently preparing the 2022 data set. So we expect that to be closer to 53 or 54 million records even that year. And this is something that was requested 284 times last year. So often this is requested by people doing research, journalists, scientists often, and it's actually requested not just by people in America. We get requests from all over the world for people who want access to this data set because it is so complete and there's a lot of research that's done from it. So thank you to everyone who does what you do every day to make sure that data is accurate and timely. And I want to give you a little glimpse of some of the ways that it is used when it's accessed. So these next few slides, I actually stole from Clay from a presentation that he had done, but he pulled just some examples of ways that the data has been used when it's been requested on a national level like that from the state or the public state data set. And there were over 1,000 results, and this was probably at least a year old. So there's probably even more now of journal research topics and journalism articles that have been done. And you can see here many topics. There's things such as racial and gender disparities that have been researched, active shooters, firearms. During COVID, there was a lot of research done of the impact that was having. I know Brooke is going to talk a little bit about the use of lights and sirens as related to ambulance crashes. There's many articles and publications that have been done related to that using this data. We talked a little about naloxone and opioid and motor vehicle crashes. There's just all kinds of topics that are being researched, and hopefully the results of that research is that changes can be made and systems can be improved and the quality of care can be improved as well. So hopefully you find that encouraging and inspiring.
You know, Lauri, another thing that I think is exciting is that paramedics are actually starting to do a lot more research, and that's been a thing that we've been promoting a lot in the industry, is that it should be coming not just from researchers who don't do the work, but people who are involved in the daily operations and work. So I had a friend call me who's going to medical school and was a paramedic with me for many years, and I was like, how do I get information on this topic that I'm curious about? I'm like, get a hold of NEMSIS. So he was able to get a hold of the data set and is working on a research project. And I just think it's amazing that that's available, to basically anyone who has a question and is curious and wants to explore research.
Yes, absolutely, Brooke. Thank you. That's a great example. Yeah. And if anyone on this call ever has someone come to you asking for EMS related data or questions about it, feel free to always refer them to us. If we don't have the answer, we can help them find it often. So encourage them to reach out or let them know this is available if they don't know. Great point. One example that Clay had used and shared with me here was that there was a study done, and this was a few years ago now in 2019, but it was a study that was done that was looking at when Uber was introduced to a city, how it affected ambulance rate and ambulance usage. And so this was done across 43 states, 766 cities, and they actually saw a 7% decrease in the per capita ambulance rate when Uber entered a city. And so that would be really helpful to know when you're planning and forecasting when Uber and Lyft are coming into an area for the first time, that there's going to be likely a change in that ambulance request or ambulance volume. Another interesting study here is EMS response time versus mortality. And this showed an association between EMS response time and motor vehicle crash mortality. And you can see the correlation there, but this was based on 2.2 million responses to motor vehicle crash in over 2,000 counties that it looked at. And it used NEMSIS data. It also linked it to the fatality, the FARS data by county. And you can see it indicated an increase in motor vehicle mortality with every additional minute of response time. And so if you are at an agency level trying to show why it is you need more ambulances or why you need increased staffing, because response time really does make a difference in mortality and in the ability to save someone's life and how quickly you can get there. This is a study that you can reference that is using NEMSIS data as well in their results. So, Brooke, is that something that you ever saw from an agency level, was desire to increase response time or ways that they tried to show that the value of that?
Yeah, I think a lot of contracts are based on response time for ambulance agencies, especially private agencies. And then, public agencies are also report into their cities and counties on how they're doing and how they're responding. So looking at this information and being able to say, hey, we need funding for another station in this area because we're seeing an increase in accidents around these intersections, or we're seeing an increase in these types of emergencies in this area, and we need more people here to improve our response times. I think that's very valuable information and helps, especially when budgets are tight and you're trying to figure out how to best allocate funds.
Mm-hmm. Yeah, absolutely. I can see that. Thanks for sharing that perspective. This next study shows, and again, this was a few years ago now, this was 2017, but they did a study that showed if neighborhoods behind street barriers during marathons received delayed EMS care compared to a neighborhood away from the barrier. And so they looked at data in 11 of the largest US cities during urban marathons there, and over 3 different years as well of information. And so there were over 62,000 EMS activations that were looked at, and they looked specifically at patients over 65 years old who were experiencing chest pain. So this would be like an urgent situation. And on average, transport time was 4.4 minutes longer when there were barriers or other things that delayed assistance during that time. So as an example, this may be a study that you may want to share if you have a city planning committee or if you have a marathon that takes place in one of your cities. You may want to consider sharing this as they consider kind of best practices as far as additional ESM or EMS personnel or support, or even strategically placing ambulance staging along a marathon or even a parade route or something like that in your city. If there's situations where streets are blocked for an extended amount of time, this study can hopefully encourage people to keep that in mind when they're planning in order to still be able to provide timely patient care during those events.
And it's not even just the route that's blocked off, but the impact to traffic all around that as well. So, all of those things we have to take into consideration when planning for those events and responses. Definitely helpful information.
Yeah. So it's interesting to think that the EMS data was used in that research and report and in that planning. And then when I asked state data managers just about popular uses of how they have used in their own experience EMS data, one mentioned that the cube was often used, as I mentioned, to compare state response time to maybe a regional or national. Another mentioned that they used the cube to often compare scene time, either to region or national times as well, and then to fulfill requests from state EMS directors or state medical directors. So if you have people coming to you wanting information or wondering where to find this information, you now know where to find it or who to point them to if you don't have the information. We're happy to help them as well. And then comparing the number of files received to the number submitted. That's something that state data managers often use these tools and resources to compare. And then really the goal and the purpose is in ensuring complete, timely, accurate data that can be used to help make decisions and planning and all these things we're talking about. So this next slide shows some more uses that I thought you may find interesting. And these are all in response to COVID. So again, this was a few years ago now that this was created and used, but we were able to create a dashboard that tracked offloading time of ambulances at hospitals. And this map on the top left, you can see kind of shows hotspots where the offload time was, I think it was more than 30 or 60 minutes would cause it to be red. And then they also were tracking in the bottom right there, they're tracking influenza-like illnesses. And I'll show you a study on the next page as well that kind of shows a correlation between influenza-like illness symptoms and COVID in that area. And then they were also able to track PPE equipment. So if there were agencies that had shortages in personnel or shortages in equipment, they were able to report that to their state data manager so that they could respond accordingly or reallocate resources where needed. So this is another example of why it's important that the data is timely, that it really is being used as a public health surveillance tool. It's starting to be used more and more. And this graph shows, in relation to the last one as well, this is a study that is currently being done, so it's not published yet. But you can see here the blue line shows average ILI rates, and then the red line on these graphs show COVID cases. And so it shows COVID cases on the left, and then it shows COVID deaths on the right-hand graph. And you can see that there's really a close correlation between those two, to the extent that the EMS data is almost being used to help forecast or predict when there were going to be spikes in COVID or surges in those areas. So that's pretty interesting. Is COVID something that you saw tracked, Brooke, at your local agencies, or?
Tracked more than anything else at the time, and constant update meetings on what was happening with it, comparisons with local versus state versus national, not just COVID, but also equipment and supplies related to COVID, PPE, all of those things were being tracked very closely.
Yeah. All right, another example, and I'm curious if anyone on the call has an example that they'd be willing to share on this topic, but we know that data is very useful when applying for grants and grant funding, and it's helpful to be able to track your deliverables as well as identify specific quality improvement goals that are related to data. But is there anyone on the call that wants to share an example of how in your role or in your state you've seen EMS data be used in grant funding? Okay, that's okay. We've got a quiet audience today. Our next topic, I skipped 2 ahead just a second. Our next topic is policy making. And this is something too that I know states are often working on setting policies. We've seen states set policies around the timeliness of the submission of data. So tracking submission lag of how long it takes between the time an incident happens and the record is submitted, and trying to increase that is one thing you may want to consider when looking at policy making in your state. And then another topic is just the completeness of records. There might be policy set around enforcing the submission of complete records or requiring that certain elements be collected on a state level. And some states also, I know, have a requirement that the data has to be collected using the most current data standard. And so you probably are aware we're switching to an updated version now, the version 3.5 of the data standard. And that is in response to improvements and changes and improvements to quality of care that are being requested and required. And so that will continue to update and change as time goes on. And we want to make sure that what we're collecting is as timely and accurate as possible.
Yeah, I think that there are a lot of agencies who just kind of arbitrarily pull numbers out of a hat to say we want the record done in this amount of time or before your shift or things like that. So if we have some kind of guidance from from states or just in general about what the best kind of time frame should be there, I think that was really interesting. I also saw something pop up in the chat about some studies. I think it said around timeliness and correlation to accuracy in the records. And there are studies out there that show like your recall definitely significantly decreases the amount of time that goes by. So, maybe putting something together that looks at those studies and compares it to recommendations for timely record completion would be a great project.
Mm-hmm. Yeah, great. Thanks for jumping in on chat there.
I also saw Sam put something in the chat about grants, and I'd love to hear a little bit more about that too.
Mm. Sam, do you want to share about that?
Sorry, trying to unmute. No, this was very simple. Just went back over a few years, did a very simple trend line because we've had increased call volume. started prior to COVID. Obviously, COVID was a little bit of a bump, but simply being able to show numbers, and also did, as part of this, did a heat map to show, based on locations, how there were geographic changes in our responses, necessitating us to actually move vehicles, create a new substation, things like that. So the data wasn't simply numbers, it was also ported into GIS.
Interesting. Thanks for sharing. Sam, where are you located? What's your role for people on the call?
I'm in New York State. I do quality assurance for an ambulance service in Rockland County.
Excellent. Thank you. Thanks for sharing that example.
Yeah. Another thing too, I think that, COVID showed us was that we don't need to take 2 years to get actionable data. And that's one thing I love about your dashboards and information that's, very timely, is that we can get that information quickly and make changes in something that's a very dynamic problem that needs fast response.
Mm-hmm, mm-hmm. Yeah, and that's my last screen and point here today really is the timeliness of the data. And we appreciate, I know there's a lot of states that are working to improve this in their state, and agencies that are working to improve this. So thank you for that. But we actually receive, you can see here, 22% of the records within a little over a day, 50% within 3 days, and up to 99% of the records within 2 weeks. And so we'd love to see that completeness of records improve even to less than 2 weeks. We'd love to receive the vast majority of the records within hours or a few days even, so that these dashboards are as useful as possible to the people who are accessing them and using them. And hopefully we'll see an improvement in that in the years to come. But that's all I have for today. And then I'd love to pass it over to Brooke next, who is going to take it from there and share it as Julianne shared. And when she introduced her earlier, Brooke really is a subject matter expert in this area and has a vast number of years of experience in EMS data and working in performance improvement in different levels. So thank you for being on the call today and sharing as well, Brooke.
Sure. Thanks so much for my invitation.
Yeah.
So just to talk a little bit about historical quality efforts, I started in EMS when we were doing paper documentation. So I remember those days of filling out my paper patient care report. I would turn it in and there wasn't a lot of actionable information happening from that, so we would submit that, and maybe we would get some feedback from billing if there was a problem, or, maybe a supervisor would look at it when we turned it in and give us a little bit of feedback right then, but we weren't getting a lot of actionable data from those paper forms. Another thing is that EMS has been historically very good at quality assurance and retrospective chart review. So we've done that for years and years, and pretty much every agency is doing some form of that. But we really want to educate the industry, and we've been working really hard over the last few years to educate the industry to move away from just doing retrospective review to actually doing performance improvement and quality improvement in our agencies. So if you'll advance to the next slide, just want to talk about what is quality improvement. So and one more click, it's a framework that we use to systematically improve the ways that we deliver care to patients. So we don't want to just look and make sure that we're staying status quo, that's quality assurance. We want to improve what we're doing, and we need data to do that. And I think that, again, it's become much easier in the last few years, especially with electronic documentation and patient care report vendors putting analytics and data into their packages so that we can access that information a little bit easier, and having dashboards like the NEMSIS dashboard, that we can access and look at. So we're starting to get all of that data in, and we're starting to figure out as local agencies how to look at that data, for one, how to interpret it, and how to turn it into things that we can actually improve patient care with. So next slide shows you kind of an example of how we will look at this data in our own agencies. So this is an example of stroke exam performed. So did the crew fill out that section of patients who had an impression of stroke? And, did they fill out that they did a stroke exam? And what type of stroke exam? It varies from agency to agency, but, was one done and completed? And, you know, if you look at this chart, at the beginning of the project, it was pretty low. It was around 40% of those patients that were having a good documented stroke exam. And so this is, if an agency sees data like this in their analytics that are coming back, they can say, wow, you know, that's an opportunity for us to do better in this area. And so, you know, they can do different things, and you could see some things marked on here of like memos and training and different things that they tried that didn't really move the needle on getting that stroke exam done and documented well. And so then at some point during the whole process of improvement of this project, they realized that they could do a validation in their documentation software and make it a requirement that if people selected the stroke impression, that then it would require them to fill out that assessment form. And so that actually helped improve the documentation and the data quality of those the stroke patients quite a bit with that change. Now, still, you say, well, if it's a validation, like, why would it dip, right? But there are all kinds of ways that people can get around validation programs. So you still have to keep an eye on changes and make sure that they're sustained and that you don't need to do anything additional. And you know, this helped show that and kind of give feedback and sustain those changes over time. But this is a great example of identifying a problem, seeing something that's, you know, in the lower percentages, figuring out ways that you can address crews and educate and change your systems so that you can improve that quality of data and actually improve patient care, because obviously we want all of our patients to get good assessments, good exams. That helps us lead to good decision making for them. So next slide, I'm going to talk a little bit about benchmarking. One thing that I hear a lot from agencies is that are using their data already well is like, well, I see my data, but I don't know how I'm comparing to other agencies. And I think that's kind of a difficult subject, right? Because comparison, depending on your mental attitude of it, can be positive or negative, right? So we don't want to look at other agencies and feel like we're so low that we can never get up to where we need to be and just give up. And we also don't want to think, oh, well, I'm above the mark, so I don't need to do any work here. That's not necessarily always true either. So we really want to think about benchmarking not as comparison, but as collaboration. So if you see someone who's doing really great in a certain area, another agency, being able to talk to them and collaborate with them about what they're doing and how they're doing it so that you can take those ideas to your own agency and implement them and see if they help in your system is really the goal that we strive for with benchmarking. And if you go to the next slide, I want to talk to you a little bit about the National EMS Quality Alliance. So that's kind of what we're all about with NEMSIS is developing performance measures that are national performance measures. We have a very robust process that we go through to look at evidence and make sure that everything that we're recommending as a performance measure or something that you should be looking at agencies is something that's scientifically valid, has strong evidence behind it, that it's something that we should all be looking at and striving for in our practice. So we have released a set of performance measures. We're getting ready to release some more this year. And NEMSIS has a dashboard that actually has all of those measures built in, which is amazing because you can then do your comparison or your benchmarking analysis to see how those work, or where you are compared to the rest of the country, which is pretty interesting. And you may have heard a little bit about the National Lights and Sirens Project, or maybe you haven't, but we mentioned it a little bit earlier. NEMSIS is actually participating in the first ever National Improvement Collaborative. So we are taking the Safety 01 and Safety 02 measures around national lights and sirens use and response and transport. And we have a collaborative of 50 agencies across the country. We tried to choose agencies that varied in size, varied in type of agency, public, private, rural, urban. We wanted a little bit of everybody so we could get some really good information out of that for any type of agency. And we have all of those agencies working together on improving their safe use of lights and sirens. Because as we said before in one of the slides, lights and sirens and response times are important, but really in only about 5% or less of our responses do they really make a difference to justify that they're used, because there's a lot of evidence that say there are extra accidents, extra safety issues with using them. So we want to make sure that it's like a prescription, right? Or a medication, that we're using it where it's indicated and we're using it responsibly. So that's one thing that we're working on. But we want to, in this collaborative, have everybody try different ideas of how to implement that, how to measure it, how to educate communities on the importance of it and the effective use of those lights and sirens. And so that collaborative is all about that. We've been collecting data for about a year now, and we're getting ready to write up and publish that data so that we can share that nationally with all agencies and be able to show these are some change ideas that you can try in your agency and see how they work for you. Have that package and those tools and resources available. So it's really exciting to be able to have all those agencies come together, be willing to share their data in a collaborative and helpful way. And we use NEMSIS data to, to discuss that and talk about that and look at where everybody stands. So it is a great collaboration that we've been able to form. It's been a great cooperative agreement too. We are looking at starting another one for this next coming year. So stay tuned for more information about that. It's pretty exciting. And I also really appreciate NEMSIS collaboration, everything that we do with NEMSQA, because we do have a person who sits on, all of our meetings. Usually it's Clay that comes and gives us great advice in collaboration with NEMSIS. And, we wouldn't be able to build these measures without having a really good guidance from NEMSIS and what the definitions of all of those things we're collecting are and how they should be properly documented and interacted with our data. Any questions so far on any of that?
There is a question in the chat from Karen in Florida, and she just wants to know, will any of the Florida FAIR measures be included at some point?
Yeah, so the FAIR measures, we contracted with NEMSQA to build those under our process. So basically they went through our very robust process of validating those measures, testing them, making sure they were scientifically sound. So they are actually owned by Florida. They worked with us on that. But one thing that we're doing with NEMSQA is we're looking at releasing validation of measures that are already existing. So think of things like the FAIR measures or like the NHTSA measures, or different states have their own performance measures. So part of what we're hoping to do in the coming year with NEMSQA is not reinvent the wheel and redo all these measures, but to say, hey, we looked at this group of measures from this area, and we put them through our process, and we're going to now endorse those measures. So you will see that hopefully coming in the next year. And the FAIR measures, since we've already worked on those, obviously we would endorse those as well. Does that answer your question? Any other questions around that? Okay, perfect.
And there is a link in the chat as well to that performance measure dashboard, and that is a public facing, so there's no login required. Anyone can access that. So if you've never explored that, I encourage you to check out that link.
So next slide, I want to tell you just a little bit about more about how we did that Lights and Sirens project. And I want to thank Plum EMS and EMS One. Plum has been one of our great success stories in this national project. They have made some significant improvement in their responses without lights and sirens and their safe lights and sirens responses. So if you look at their chart on the left there, those were their transports without lights and sirens. So the percentage of time that after they had picked up and assessed and treated the patient, they transported normal traffic speed or no lights and sirens. So they were already doing very well in that area. They didn't have a lot of improvement in that one. And we usually recommend in the project that's about 5% or less when we've looked at the data. So they were doing great there. But they did have some work to do in their responses. So that one, we want to try to get that lower as well, because like I said, only about 5% of the time are they really indicated that we found in the research. So they saw a need. They did a lot of education with their providers, with their community, making sure that everybody understood why they were doing and what they were doing, and they were able to decrease the use of lights and sirens by quite a significant jump there. So that information is going to be included in that package. They've actually published some articles with EMS1 around this and their success that they've had. So that's where I grabbed these charts and information. So, appreciate them all sharing that information with everyone and their ideas. So you'll see more to come with that. But one thing you can do if you go to the next slide is we can look at their comparison with that NEMSIS dashboard. So, this is the same public-facing dashboard we just talked about that I showed you, the drop-down list with all the NEMSIS measures. So in this one on the transports without lights and sirens, they have, you can see they're very high, and then the national is 47%. So they're doing great, but other agencies again can go in and say, hey, where do I stand compared to these other people? Mm-hmm. And on the next slide, we'll look at their other project. So you can see that even though, they were probably about double what or actually more than that, almost quadruple, what the national numbers were on the Safety 01, the use of lights and sirens during response to scene. They didn't say, oh, well, we're doing way better nationally, so we don't need to do anything else with this. No, they said, no, we still have room for improvement. We can improve our system and we can make changes and we can do even better than this. So that's why I say be careful getting caught in that comparison trap. You don't want to do nothing because you're already doing better than a lot of other people. But definitely you can see, that they've made some great strides, and using that information to go back to your communities and your stakeholders and show what you're doing in your programs can be a great benefit too. Can help with extra funding, can help with grants, can help with policy making and all of those things that we've already discussed. So I think that their system is a great example of this. Okay, next slide. Is that all my slides? I think we're getting close to the end here. But I do want to say, that what I think we can do overall is really facilitate quality improvement and data use for agency level. I know there's still many agencies, especially smaller agencies out there, that don't have data analysts. They don't have a quality improvement manager or chief quality officer. It's sometimes just a position that's thrown in with education or some other task, and they don't really have specialists to do that. So normalizing that in the industry and having support for those types of positions at the agency level, I think is really important to promote. Also, having that regional, state, and national support of QI efforts, being able to have specialists at the state level maybe that can go out and train people at the agency level who don't have this information or don't have a person to do it. Having councils of people that come together at regional or state levels from each agency that are able to collaborate and share ideas, is a great example. NEMSIS is actually starting an implementation committee now. So that would be a resource for people who see these performance measures, either on the NEMSIS dashboard or on the NEMSIS website, or in publications that we release. And then they can come to the committee if they need ideas on how do I access my data? How do I implement these measures? So, having those kinds of partnerships and education, I think is great. And even, webinars like this and getting that word out. I think a lot of states or oversight agencies, whether they be state, regional, or local, send out a lot of great information to people, but I don't see, these education seminars sent out as much as I would hope to local agencies. I attended the NEMSIS annual meeting, and my agency was the only agency that had field providers there. I would love it if states could get more field providers involved in, NEMSIS and what that means and how that looks and how it interacts with them and what they do. So those are all kind of my ideas for collaboration around there. And I think we're at the bottom of the hour. So I'm going to be quiet and answer any questions that anybody has.
Yeah, thank you, Brooke. We appreciate your partnership and your involvement and your willingness to share with us today. And we'd love to see you as well as many others involved in our annual meeting, or we have calls we do twice a month that are open to people as well who want to learn more or want to ask questions and share ideas. So feel free to reach out. I'll share our contact information in just a moment here. And I know we are at the top of the hour. If anyone needs to jump off to another meeting, feel free. But if you have a moment, I would love for you to scan this one more time and answer these last two questions of just one thing that you learned today, maybe something that you did not know about or excited to check out or heard for the first time today or are inspired by somehow. And then also one thing that you'd like to see included in future trainings. We'd love to get your feedback on that as well. So if you have a moment, we'd love to hear from those things. Someone learned about dashboards today. Anyone has questions, feel free to jump in and ask or comments at this point as well. Dashboards and yeah, go ahead.
There's a question about the recording being available.
Yes, the recording will be available. We'll edit it so it'll take a week or so to show up, but it will be available on our website under trainings, I believe is the topic where it's listed. Public trainings, new ways to look at EMS data, opportunities to use NEMSIS data, reconciliation. It can not only be used, but resources, how to access with good information sharing. Thank you. That's all great feedback. And then let me go to the next one. Keep answering because we can read these afterwards as well. But if there's any topics that you'd like to see covered in future trainings, we are always open to that and are looking for ideas for that as well. So if anyone wants to share, we would love that. And then I will go on to our contact information. This is my email here at the NEMSIS TAC, and then Brooke shared hers as well. If you want to reach out to either of us with questions, we'd be happy to chat further. So thanks so much for joining us today. And thanks for coming. And again, yeah, look for this recording if you want to share it. It'll be available and you can pass it on to someone else that you wish could have been here, that you'd like to hear this information.
And thanks again for having me.
Thanks, Brooke. Appreciate it.
Thanks, everyone.